Hello and a very good afternoon to everyone joining me on this News9 Facebook Live, and to continue the updates on coronavirus cases that have been reported. Like we mentioned, it is for the very first time that the daily caseload has breached the 90,000 mark. Fresh cases have been reported. Now India has also become the second worst affected country across the world. So the numbers continue to rise. As always, when we look at the recoveries, 70,000 recoveries have been reported. But while that might be that one silver glimmer that we are seeing, it's quite worrying that the number of deaths has also increased and it continues to rise. In a few of the states across the country, the numbers are rising exponentially as opposed to the other states because of the geography of the country being so different, and of course the demography of the country also being so different in each of these places. There are some places that are seeing cases increase manifold, whereas in a few other areas it seems like the situation has come under control. Among the new cases that have been reported, the bulk of the cases have been reported from 3 states. And these are 3 states that have been badly affected from the very beginning of the outbreak of the pandemic. Which are these 3 states? Maharashtra, Karnataka, as well as Andhra Pradesh. So Maharashtra has been the worst affected state across the country for a long time now. Since the beginning of the pandemic as well, Maharashtra had been badly affected. But despite that, even now, the cases have not come under control. On the other hand, Karnataka, initially it seemed like the situation was under control. That was when the national lockdown was in place. But immediately after that, things started slipping up, and in Karnataka as well, the number of active cases being reported continues to be on the rise, and it hasn't come down yet, as opposed to a comparison with other states like Delhi will perhaps show that in Delhi the number of active cases immediately dropped very soon, just when it seemed like situation was getting out of control. But in Karnataka, weeks into the pandemic as well, the active cases continues to be on the rise. So that's something for Karnataka to think about, to work on as well. In Andhra Pradesh as well, initially, of course, the numbers were low, but it was attributed to low testing that was being conducted in the state. And this is an issue that the state is facing even now. There are several rules, many criticized by experts as well, that is the reason why things went haywire in Andhra Pradesh, including not having quarantine rules as well. Of course, the government was focusing on business, but that also meant that the cases rise exponentially. In the cases that have been reported across the country in the last 24 hours, 46% of the cases that have been reported are from these states. More importantly, if you look at the data, over 52% of the deaths that have been reported are from these 3 states. That's an extremely worrying statistic. Because on one hand, every single time when we talk of the number of cases being reported in the country, the focus is equally on the recoveries as well, and that has been one hope, or something that the doctors have also held on to as a glimmer of hope in such times, that the recovery rate in India is quite good. But these 3 states in particular, the number of deaths is also high. Maharashtra, Karnataka, as well as Andhra Pradesh have accounted to more than 52% of the deaths that have been reported across the country in the last 24 hours. And the number of deaths has been quite high in these states over the last few days as well. Maharashtra in particular, like we mentioned, despite the measures that are being taken, despite partial successes that it has seen in a few places like Dharavi as well, that has been hailed by the UN, despite continuing the lockdown for a lot longer than the other states, the situation still seems out of control. It still continues to be the state with the most active cases, the most number of cases as well. On the other hand, in Karnataka as well, the centre has now stepped in and has asked to ensure that there is more testing. It is a criticism that Karnataka has faced time and again. Among the South Indian states as well, Karnataka had one of the least numbers initially. The numbers have improved, have picked up, but it still needs to be increased a lot more. So a lot more testing that needs to be conducted in Andhra Pradesh as well. Talking about Andhra Pradesh as well, the focus being to ensure that early treatment is given out. While talking about the number of deaths being high, one of the key factors is also not having early detection. Why is it that in a few other states the recovery rate is so high, and why is it that in a few states it's so low, and why is it that the mortality is so high? The answer is because firstly awareness, awareness that's reaching out to every single person, and secondly also the fact that there is early testing. The earlier we test a person, the earlier we know the symptoms that are available, the easier it is to treat a person for COVID-19 as well. And that seems to be lacking in these three states, which is why the center has said that the focus should be completely on testing a lot more than it is doing currently. Increased testing manifold. Apart from that, early detection as soon as it is known that somebody has been infected with coronavirus, take all the precautions. In Karnataka as well, many, almost 90% have opted for home quarantine. And initially, home quarantine had been brought in to ensure that our healthcare facilities are not overburdened or overwhelmed by the numbers that are coming in. But home quarantine has turned out to be a welcome relief for people as well who did not want to go to these facilities. A lot of it also attributed to several patients who had spoken of the horrors that they faced in some of these hospitals. So because of these factors, many also have taken to home quarantine. About 90% of the cases being reported in Karnataka, patients have opted for home quarantine. But this also means that when their situation deteriorates, they are unable to reach out to the hospitals in time, and that could also be one of the reasons why the mortality is increasing. So various factors, but now of course the center has stepped in to say that the states must ensure that they are taking all precautions to ensure that early detection takes place and the spread of COVID-19 also decreases a lot. So the onus remains on these states. The center also needs to intervene on the same to ensure that it is provided with all facilities and it ensures that people are at a much safer place than they are right now. So for the next few weeks as well, the center is also going to monitor the situation in these three states, which is going to be extremely important in the numbers that are going to be reported across the country as well. So for these states in particular, we need to be more careful while we are here, take all the precautions, and while the government is doing its bit, we as the citizens also need to do our bit. So continue doing what we have been doing until now to wear face masks, ensure that we maintain hygiene and also physical distancing as much as possible. Thank you so much for watching this video. I'll see you in the next video. Stay home as much as you can. Take care.